And looking at colonic biopsy, what is striking is that mucosa appears quite blue. That means there are a lot of inflammatory cells in the lamina propria. And crypts appears less in number. That means there is crypt atrophy. Where crypt should have been, all that we can see is lot of inflammatory cells, and crypts are not touching the lamina, this muscularis mucosa. That means there is lymphoplasmacytic infiltrate above the mucosa, muscularis mucosa, and separating the crypts. This is the best fragment, well oriented fragment in this biopsy. And what we can see here is that there is lot of architectural distortion. Normally the colonic crypts should have been parallel to each other like row of test tubes, and they should be equidistant from each other. Both the things are not happening here. What we see is some dilated crypts, some branching in the crypts, and muscularis mucosa is right at the bottom. Almost the inflammatory infiltrate is almost destroying the muscularis mucosa. That much inflammation, basal plasmacytosis is there. So that means these are all features of chronicity. That means it is chronic colitis is sure. And what about activity? For activity, we have to look at cryptitis and crypt abscesses. Let's look around and see what we can see here. Let's move to the little bit higher power. So look at this. If we reduce the light, even it will look even better, I guess. If we reduce the light, yeah, here. After reducing the light, the inflammatory cells are quite well seen. This crypt is almost being destroyed by inflammatory infiltrate. The inflammation is going inside, cryptitis is there, and this is the famous basal plasmacytosis, this band between crypts and muscularis mucosa, band of inflammatory cells, lymphoplasmacytic infiltrate. And this fragment shows muscularis mucosae, but all the mucosal crypts, just a remnant of crypts are there. Most of the crypts have been destroyed by the inflammatory process. Few crypts are seen here and there, distorted. They are not equidistant from each other. Here also the signs of chronicity are evident. The inflammatory infiltrate has overrun the normal architecture of the mucosa. Crypts are literally, it has overrun the crypts. It has destroyed some of the crypts. So these are all features of chronic colitis. So this was a rectosigmoid biopsy, and clinically also it was suspected as having ulcerative colitis. Overall the picture seems to be in favor of ulcerative colitis. Thank you very much.